Hello everyone. Today we are going to discuss another case in pregnancy. So today we'll be going to know how to manage a peptic ulcer in pregnancy. So let us start. As I told you, I will not go into such details of the diseases. Like today we are going to discuss peptic ulcer. I'm not going to discuss a lot of details. I'm just going precisely case to case, that tomorrow if you're going to have a selection of medication for a pregnant lady, so you feel confident in safely giving these medications. So let us start. A pregnant lady comes to your office and she's complaining of epigastric pain, substernal burning sensation, metallic taste in mouth as the acid regurgitate into the esophagus and it causes metallic taste, blotting sensation after eating, postprandial blotting, nausea and vomiting. So you decided to do a urea blood test which came to be positive, or you decided to do a stool culture and it came back to be H. pylori positive. So now you got the diagnosis. So how would you approach such a patient? How would you approach and how would you manage the patient? So even if you have been called for the consultation regarding the pregnant lady with the same tests above, the same presentation above, so how would you manage such patient? So here, as we know, it's a peptic ulcer disease. So we want to know whether it is a gastric ulcer, whether it's a duodenal ulcer. Difference between is if the pain is while eating, it's a gastric ulcer, and if the pain is at night after 2 to 4 hours after meal, postprandial, it is duodenal ulcer. So how would you manage the pregnant lady? You would manage the patient. First of all, we will start with the lifestyle modification, which is generally given in any form. If the patient is pregnant, not pregnant, you need to start with the lifestyle modifications like elevating head of the bed at night during sleep, no eating before 3 hours to bed, eating light foods, eliminate trigger foods, stop smoking, alcohol, chocolate, caffeine intake. So these are the lifestyle modifications which can you do to decrease the severity of GERD. So now if you want to manage the patient pharmacologically, so how would you manage the patient pharmacologically? You would manage the patient by giving the patient a safest PPI, pantoprazole, and ESO. You can give the patient ESO also, that is OD, uh, or you can give the patient clarithromycin 500 mg BID, which is safer in pregnancy. You can give augmentin 1 gram BID, which is also safer in pregnancy. So this is a triple regime which can you give to the patient safely and safely manage the patient in pregnancy. So remember, next time if you are faced with the case in OPD, or as a general practitioner or as a specialist on your rounds, you should know that these medication can be safely given to the pregnant lady. So you need to continue this medication for 14 days, then you need to stop the regime. If you want to check for the eradication, you need 2 weeks after PPI and 4 weeks after antibiotic therapy to be stopped, and then need test through the urea blood test. So it's a short, precise, concise case which we are going to discuss in this series. As I told you, I'm not going into such details. So we need such medications, such regime to be followed in pregnancy. So thank you for watching. Please like and subscribe my channel for upcoming lectures. Thank you.